menstruation look like when pregnant? What about your menstrual experience? It does not come for 2 months. I need to check it.
Honey! Oh my god! See. We have child.
We are becoming from Mama and Papa.
Oh!
Tomorrow, I will take you to hospital.
Let's go!
Hi.
Oh, congratulations! You pregnant for 2 months. Is it the first time when you're pregnant?
Yes, it is. What should I do?
You should follow the program. We check mother and your infant. I will explain you. Let's listen it together.
Screening for mother and infant. What is the maternal checkup and when? 1 to 7 weeks examination, CBC, Rh blood group, rubella, hepatitis B, HIV, syphilis, and urine culture. 8 to 18 weeks examination, ultrasound, alpha beta protein, amniocentesis, and chorionic liquid sampling. 22 to 48 weeks examination, CBC and DM. 32 to 36 weeks examination, ultrasound, syphilis, CBC fetal health monitor, special examination, HIV and thalassemia.
CBC to see the integrity of blood cell and see to blood group if the doctor will give blood medicine.
Rh blood group. The problem arises when a mother has a negative Rh, negative blood pregnancy, and fetal Rh positive blood. But whenever blood can pass to mother blood, this can pass to baby causing blood to crack and pale. The child does not develop cerebral palsy and death.
Rubella. A woman infected with the rubella virus during pregnancy can transmit the disease to her baby fetus, and serious birth defect called congenital rubella syndrome could develop, especially during the first trimester. Birth defects of congenital rubella syndrome include cataracts and other eye problems, hearing impairment, and heart disease. Miscarriage and stillbirth are also possible consequences for pregnant women.
Hepatitis B, maternal infection with hepatitis B virus HBV or hepatitis C virus HCV can expose the newborn to a subacute chronic hepatitis infection.
HIV testing for human immunodeficiency virus HIV infection has become routine prenatal care. The blood test as part of preconception care or early in the pregnancy. This best protect the mother and baby. Syphilis. Syphilis is most commonly transmitted sexually. If untreated during pregnancy, syphilis can cause infection of the fetus, running to the spontaneous abortion, late-term stillbirth, premature birth, low birth weight, neonatal death, or congenital disease, and long-term sequelae such as neurologic impairment and deafness. Ultrasound. You may have ultrasound performed at different times in your pregnancy to check for fetal growth, estimate your due date, and look for any structural abnormality in the baby. Amniocentesis. It is used to diagnose chromosomal disorder and open neural tube defects, such as spinal bifida, Testing is available for other genetic defects and disorders depending on your family history and the availability of lab testing at the time of the procedure. Chorionic villus sampling (CVS) is prenatal test that involves taking a sample of some of the placental tissue. This tissue contains the same genetic material as the fetus and can be tested for chromosomal abnormalities and some other genetic problems. Unlike amniocentesis, CVS does not provide information on open neural tube defects. Therefore, women who undergo CVS also need a follow-up blood test between 16 and 18 weeks of pregnancy to screen for these defects.
Fetal monitoring. During late pregnancy and labor, your doctor may want to monitor the fetal heart rate and other functions. Fetal heart rate monitoring is a method of checking the rate and rhythm of the fetal heartbeat. Glucose testing. A glucose challenge test is usually conducted between 24 and 28 weeks of pregnancy. Abnormal glucose levels may indicate gestational diabetes. Urine culture. Detect bacterial infection in the urinary tract, which can lead to kidney infection or increased risk of preterm delivery and low birth weight. Alpha-fetoprotein. High levels of AFP may suggest that developing baby has a neural tube defect, such as spinal bifida or anencephaly. Thalassemia. Sickle cell disease or SCD and thalassemia are inherited birth disorders. If you are a carrier of sickle cell or thalassemia, you can pass these conditions on to your baby. Pelvic examination. During pregnancy, these checkups are to monitor your health and well-being, as well as to check on the growth and development on your baby.
Then I am sure to follow the program for the child.
Even if you do follow the program, please remember good food and good mental that has affected to your baby. Keep yourself in the good way. It can help your baby development.
Okay, thank you so much.
She gave birth and their baby are healthy and lovely.